This one. Hello and welcome again. Am I on? Okay. Guys, there's been a slight change of plans. Dr. Tushar was supposed to talk about the right atrium. Unfortunately, his computer is crashed. He had a nice video for you. So I would be just continuing on. And I'll tell you a few things about the right atrium before we move on to the next speaker. Okay. Okay. So can you focus? Okay. So this is the right atrium. So just to talk about the right atrium, the right atrium contains three parts. Okay. The SVC enters into the right atrium from here, and the IVC enters from here. Okay, so IVC, SVC entering the right atrium. And what you normally see in the front is a huge right atrial appendage. It has got a broad base and it's triangular. Okay, and if I trans-illuminate it, you will be able to see the pectinate muscles. Okay, so that is so you can see the pectinate muscles coming off. So they come off the terminal crest, the crista terminalis. Okay, and then this entire area is the rough part of the right atrium. Okay, so these are all the pectinate muscles. So that is the appendage part of the right atrium. That part of the atrium which takes in the drainage from the SVC and the IVC is more smoother. So that forms the sinus venarium, or the sinus part of the right atrium, which receives the inflow from the RA, from the SVC and the IVC. The other part is the part which leads into the tricuspid valve. So that part is the vestibule. So you have the sinus venarium and the appendage part, and the vestibule part. So these three together form the right atrium. Okay. So we saw what the terminal groove looks like, and that terminal groove here would be the terminal sulcus on the outside. So this shows you the Waterston groove here, and that is the terminal sulcus, and in between is the smooth part. This is the rough part. So these two grooves are there to tell you which is the smooth part, the anterior rough part, and that this pectinate muscle goes all around, makes it the right atrium. The left atrium is very smooth. See, you need to recognize these chambers of the heart by the morphological features and not by whether they are to the right or to the left. This is what cardiac morphology is all about. You may have somebody with a situs, you may have somebody where the parts of the heart are missing. So how do you categorize all these things about? It's all about morphology. So a right atrium will have an appendage like this. A left atrium would have an appendage like this, which is narrow and small. So this sort of a tail-like appendage belongs to the left, and this sort of an appendage belongs to the right. So by looking at these things, you need to say that it is left or right, and not if it is to the left or right in actuality. Okay. Okay. Now, when you open the atrium, let me show you a few of the structures within the atrium. Okay. Okay. So in this specimen, we have opened out the tricuspid valve. The RA is above it. The RV is below it. The RA is above it. Okay. So now, when you see, you will find that this is the septal leaflet of the tricuspid valve, and this is the coronary sinus. Okay. This is the fossa ovalis, which you see transilluminated there. Now I will transilluminate the whole thing from within the LVOT. So when I transilluminate it from the left ventricular outflow tract, you will find that is the membranous septum. Okay. So keep the light on. See, this is the membranous septum. So this is the septal leaflet which is getting attached across the membranous septum. So if you see below the septal leaflet also you have membranous septum, and above the septal leaflet also you have membranous septum. Okay, so below and above. So this is the atrioventricular part of the membranous septum, and below the septal leaflet is the interventricular part of the membranous septum. Okay, so that light there under the septum, under the septal leaflet of the tricuspid valve is the membranous septum, interventricular part of the membranous septum. And this is the atrioventricular part of the membranous septum. This would be the muscular part of the atrioventricular septum. So together this whole area would be the atrioventricular septum. And the bundle goes across like this and enters there. And if you see here, you have a triangle called the triangle of Koch, which will tell you where the bundle lies. Okay. So this is the coronary sinus. Okay. And if you carefully see, you can see the Basin valve here. Okay, can you focus it a little bit? Here. Light, better light. Not you. Okay. So are you able to see the Basin valve? Okay, okay. So this is the eustachian valve. Okay, so this is the eustachian valve, the eustachian bridge, and this along with this Basin valve have formed the tendon of Todaro, and the tendon of Todaro goes across here and gets inserted into the central fibrous body. Okay, so Basin valve, coronary sinus, eustachian valve, eustachian bridge, both joined together, tendon of Todaro getting inserted into the central fibrous body. So this tendon of Todaro, the coronary sinus, this septal leaflet where it's attached here, give rise to this triangle, which is the triangle of Koch. And your bundle goes across like this, and at this membranous septum dips inside. And when you see on the inside, you will find there is this medial muscle of Lancelot, which is a marker. It supports the anteroseptal commissure of the tricuspid valve, and that is where the compact bundle has pierced. Okay, so these are all the structures that you need to know here. One other structure in the right atrium which I would like to show you of interest is this. This is the Chiari network. Okay, so this is the Chiari network. Are you able to see that? Okay, that's a better focus. Okay, so the Chiari network is a remnant of one of the valves of sinus venosus. Okay, so the Chiari network, that is one of the remnants of the valves of sinus venosus. The other thing that I would like you to know is the relationship which the aorta makes with the septum. Okay, so I put my finger in the aorta, and that is the interatrial septum. Okay, so the finger in the aorta moving the interatrial septum. Okay, so it's somewhere here. Many times you would open the septum perhaps to replace a mitral valve, and you need to know that those sutures, or maybe sutures when you're closing an ASD, must not go on the aorta. Okay, the non-coronary cusp of the aorta is right there where your sutures might go. So you need to deliberately suture only the septum, and your needle must not go deep into the aorta, which is right there in this region, which is called the torus aorticus or the aortic mound. Okay, so that is another of the things which your needle will jump when somebody is trying to enter into the septum, into the LA across the fossa ovalis. Okay, so when the cardiologist is trying to scrape the needle across, he comes down, one jump on the aortic mound, another jump on the limbus fossa ovalis, and then into the LA across the fossa ovalis. Okay, so that's 1-2 jump right in. So that's for the cardiologist to know as well. Okay. Good. So I think this completes most of the structures that we have in the right atrium, and I think we have seen them well. And we would now go on to the next speaker who would tell us a little bit about the tricuspid valve, Dr. S.K. Nair.